Good morning. Good morning. Happy Friday. Good morning. Good morning. It's been a very long morning so far. I did not forget. I did not sleep in. I was working with Step 2 CK all morning. So I work with doctors overseas, international, and the time zones do change. Obviously, I have different time zones. So I was up at 4 this morning, and then I had a student right now. She had a few more questions I had to address before I jump onto the session. So she's studying for CK. She's taking CK in about 2.5, 3 weeks. So we're doing questions on pediatrics and OBGYN. And now we're on board with Friday morning schedule biochemistry step 1. So it's important to really focus on your step 1 foundation. I know a lot of us are trying to get through to pass and move. Eventually, it's going to catch you with step 2. So whether you're a medical student now and you want to participate to then do rotations versus you just pass, you're going to pass step 1 with us and jump into step 2. The sooner you could jump into step 2, the better. But some of us can't because you have to do rotations, right? So clearly, it's a 1 year of rotations, which builds your step 2 foundation to get to step 2. So if any of you here have the luxury to get to step 2 right after, this is awesome because anything you do for step 1 will transition quicker into step 2. Others who have to do rotations, unfortunately, it's 1 full year of training, which is good because you need to have training to do better on step 2. All right, so today we're doing biochem. Last week we did more vitamins. So vitamin deficiencies and toxicities are very important. Understanding the different water-soluble and fat-soluble vitamins are important. You need to know the cofactors and branch out from there. Today, I chose a pretty good list of questions. I'm proud of myself. These questions are about 16, and they range quite a bit from pathological questions dealing with biochemistry to certain conditions. I'm smiling and smirking because people who know me know I have a certain routine of questions I ask. This is coming from left field, meaning you guys know what you have to do. Vitamins are vitamins. Metabolic pathways are pathways. I can't teach you this in 2 seconds, right? Glycolysis, gluconeogenesis, TCA cycle. That's a whole semester's worth of work. You need to know the pathways. That's it. You had it undergrad if you did a biochem major. If not, you're in medical school. You saw it at some point. So don't care what school you went to. Either school taught it to you or you taught it to yourself. You have some experience or exposure to the pathways. That being said, we're here to get points. So the questions I choose are questions that can help you leverage the exam, questions that will help you with your diagnostics, I was going to say, and things that maybe look familiar, but you forgot because you haven't done it in a while. So it's up to me to bring it up to you. That's why there's a reason why I do biochem 4 times in a month. If you stick to my routine and my structure, I can promise you your scores will rise. But the problem is it's you have to stick to some routine, right? Whatever schedule you're on right now, at least micro on Wednesdays, biochem Fridays, immuno Mondays. These are places where either you're listening to me, you're participating, or you're actually implementing what I'm telling you. You will get the points. You really will. So let's do some questions. Let's work on application because all of you here are studying. East Coast, West Coast, anywhere in the world. You're on your own typically, right? You come to me twice a day for this, to apply, to see me do questions, see us do questions, participate, trigger certain concepts, memorize certain things if we have to, understand certain things if we have to. That's the whole point. So we have people raising their hands. I see Dr. T raise his hand, so I'll do 1 or 2 questions, Dr. T. I want more of us to raise our hands, so I will answer 2 questions with Dr. T. And then if you want to participate, ladies and gentlemen, this is the time to do so, to see what you know about biochemistry. All right, Dr. T, come on board, man. What's going on? How you feeling?
I'm feeling good, Doc. How are you doing today?
Good, guys. I'm doing well. I just need you guys to pass this test, man. Yeah, there's a beautiful, the grass is greener on the other side. Let's put it this way. So let's pass this exam. I know it's stressful. Let's get it done. And then I promise you, it's going to be amazing time afterwards, right? But until then, we got to do it, right? That's what it comes down to. So I chose a few questions here. They're a little more challenging, but this is what biochem is. They have questions in metabolism, questions in genetics, and questions in DNA protein stuff. So I want you guys to be able to participate and at least tell me the differential, the diagnosis you think the patient has. If we can get to this point, I'm happy. The rest comes with practice, right? If we can't come up with a differential or a diagnosis, then we have a problem. So for now, day by day, if you're listening on the back end, and you're able to access the chat, tell me what the condition is. Dr. T, let's read the scenario. Tell me what you think the condition is, and then we work as a team to come up with the answer choice, right? Diagnosis is key for step one. Step two is also management. It's a whole different game. Let's do it, man.
At a routine washout examination 4 months later, the physician notices that he has a persistent head lag. On examination, he has blue eyes, pale skin, blonde hair, and generalized hypotonia. His serum prolactin level is markedly elevated. Supplementation with which of the following substances is most likely to prevent further complications of this patient's condition? We have a routine newborn screening test for phenylketonuria in a male neonate shows a serum phenylamine concentration of 44. Normal is less than 20. He started on a special diet, and the hyperphenylanemia resolves. Okay. So
So a special diet
yes,
resolves the
yeah.
situation. And what happens? Just walk us, summarize the case for us.
So there's a neonate with phenylketonuria, and the special diet and resolves the hyperphenylamine.
Yeah. And then?
But 4 months later, he's still having the symptoms of phenylketonuria, like persistent lag,
Okay.
lagging off the head.
And on physical exam, he has all these presenting signs, okay, and then prolactin's high. Okay.
Yes.
So now, you need to know all these. By the way, for biochem, USMLE, we need to know every one of these, no matter what. Well, how you approach the question, are we going to eliminate, or do you know the answer?
Okay. Yeah, I do know the answer. I know it's the tetrahydrobiopterin.
Pretty good. This is the special case of malignant PKU. Malignant PKU is something you guys should be aware of. You have classic and you have deficiency, right? So I can tell you, ladies and gentlemen, this photo is very important. You need to know not only the step-by-step process, right? But then we have obviously BH4. They will ask you questions about PKU. They would ask you questions about, the tetrahydrobiopterin. They will ask you questions about the step-by-step pathway between tyrosine, dopamine, norepi, and epi. We've done questions like this before in biochemistry. They also can possibly ask you questions of the cofactors. Do you know vitamin B6 is, B12, vitamin C, those kind of things? They love doing that. If this trips you, you should learn it because they love to do that. Now, doctor, look at the other answers, right? We have other answers here. We have tyrosine, pyridoxine, thiamine, and niacin. Why do you think people chose tyrosine?
Because tyrosine is also in the pathway of the phenylamine.
Sure, right? We saw that before, didn't we? So
Yeah.
people jumped because they figure, all right, in tyrosine supplementation, along with dietary phenylalanine, okay, restriction is required in all forms of PKU. So far, so good. Patients with classic PKU will not develop features of the disease if dietary is strictly followed. Infant most likely has malignant, which requires additional supplementation. So people who chose this is what makes you fail step. If you guys want to be real and honest on a Friday morning and tough love it, this is how you fail step. Because when you fail step, people jump. They say, Tarison, there's the answer. What did Dr. Stavros say, Dr. T? What do I always tell you guys if you choose A?
Supported the answer.
Yeah, if you choose A, moving forward, take 5 seconds and say, okay, I want to double check the answer is A, or they tricked me. Because A is a beautiful letter. I love A. I want A to be the answer, but A could also be a trick. In this case, it is a trick. So if you stop yourself and have that safety check or that spot check before, I promise you'll increase your points. So this is, would you ever see this question on the exam? Maybe not, never the same question, but PKU is very real. Now look at the PKU as possible. The cofactors are important. So read the scenario and know as much as possible about PAH, about DOPA, and about this pathway, because this pathway will always pop up on your exam at some point. I can promise you, either the picture or asking you about the next step, substrate, product, maybe a deficiency in one of those cofactors. This is how you get points, right? I'm just showing you what you can do. If you trip up on the diagnosis, we'll practice it, because I think Dr. T goes, man, this is PKU. That's awesome. So I'm happy by going through the other answer choices. What's pyridoxine again, Doc?
B6.
What do you know about B6?
Yeah, I know people taking isoniide who have B6 deficiency.
Okay. So why do you think they put pyridoxine in this case here? Why do you think they put pyridoxine, the Ambos people, in this differential list? What do you think, guys?
It's also a core factor in the pathway of
Yeah. I mean, the B6 is a huge, plays a huge role. Okay. So text talks about homocystinuria, pyridoxal phosphate. However, homocystinuria is not associated with high prolactin, and that newborn screening would show levels of homocysteine and methionine rather than phenylalanine. I know you knew this wasn't the answer, but when you keep reviewing, it allows you to cover more content. Homocystinuria typically presents what? Later in childhood. That's kind of good to know, because I can promise you homocysteine is very testable on the exam. And homocystinuria presents with what, Dr. T? Issues mentally, intellectual disability, osteoporosis, Marfanoid habitus, kyphosis. We know this one. We all know about the lens subluxation, right? Right. We know that. But I also mentioned we need to know as much as possible, because they will give you a scenario presenting these signs and symptoms and issues. It's up to you to be able to differentiate homocystinuria. Don't just know the eyes. That's not enough for step one. That's a good start. Not enough. You should know as much as possible, because they love asking you this. Oh, and by the way, when you see a picture about biochemical pathway where it shows you B6 and B12, I should pay attention to this very much. I should be able to write it out a few times and know exactly which side is B6, which side is B12, because this is what test writers love to do. They present symptoms and signs. They give you some maybe lab work, and they say, hey, what's going on if, let's say, we have a deficiency in methionine synthase? What happens? Well, clearly probably there's a B12 problem too, and this isn't produced, so it goes to this way. This is what you guys need to do. I know it's a Friday morning, and I know it's biochemistry. I'm trying to make it interesting. That's why I'm not doing genetics or DNA protein, because those stuff that's dry. I'm teaching you more of the clinical medicine for you guys to get the points. So I hope you do it. I hope you work on it. This is how you get the points. My friend, please read this scenario nice and loud. Take your time, Dr. T. And I want everybody to participate in the chat. I want the diagnosis of the patient. Let's do it.
electrocardiograph shows ST elevation in leads V1 and V2.
Okay.
His serum troponin high concentration is 2.
Okay.
Angiograph shows 90% occlusion of the